Thank you, Dr. Chan and Dr. Nam, for inviting me for this session. Hope that all of you are safe and healthy. Today, I'm sharing a NUH experience in patient education during this COVID-19 pandemic. Last 2 years has been a devastating time for everyone as we are at risk of contracting COVID-19. More so for people with diabetes, they are even more vulnerable, and how could we help them to stay healthy with their chronic disease and be safe during this pandemic? My content will include the following: the goal of COVID-19 management in Singapore, changes of patients' care in COVID-19 pandemic, include change of mode of care in outpatient setting, change of mode of care in patient education, and patient education in NUH during COVID-19 pandemic. I will also include patient education on survival skill as well as psychosocial support. For the goal of COVID-19 management in Singapore, our government would like to prevent unnecessary community exposure and prevent healthcare system overload. For prevention of healthcare system overload, for those mild symptom cases, we are strongly advised to self-isolate at home while waiting for their test result. Example, anti-aging rapid test and polymorph chain reaction test. Next, I'm going to share the changes of patient care in COVID-19 pandemic. You will find that the healthcare system, there's change in organized care, and there's also changes in patients' care in NUH outpatient setting as well as patient education in NUH inpatient and outpatient. Let's talk about organized care differently. In order to prevent unnecessary community exposure, the care at the outpatient setting will be organized differently. We will have prone detections to detect whether patients are infected or not through screening and prevent patients from transmitting the disease. Next, we will come to effective triage and isolation. Let's look at prone detection. How we detect patients when they enter into NUH. This is a level 3 screening area. All you can see is there's 1 meter apart distancing, and there's a counter, there's a patient registering at the counter. All of us are advised to check in either by safe entry token or by trace together apps before entering the clinic or the hospital. Screening tests will help us to detect patients earlier. The screening will decide whether patients are infected or not. Any flu-like symptom like cough, sore throat, or any exposure, we also check on patients' vaccination status. Next, we're going to look at the effective triage. When from the screening, if we already rule out the sign and symptom and whether patient have fever or not, when the patient come out to level 13, this is my level 13 outpatient, you will find that they will be separate in different area. For those that no direct exposure and they are not infected, the sitting area will be 1 meter apart. When you look at the chair, there's certain area where there's 2 persons when they can sit together, and in between there's a line like no entry, there's a gap that the area is not for people to sit on. When we identify their exposure and the history in traveling, we will sit them differently. Last, we look at the isolation in single room. For patient that is identified that they're possible in be infected, then they will be isolated in an individual room. It can be a single room, and the primary physician will be notified and see the patient in the room. Next, we're going to see that there are certain patients that are suspected of having or diagnosed with an airborne infectious disease, then they were isolated in a negative pressure room. In this room, we can control the airflow in the room and minimize cross-infection And physician will see patient with full PPE. Full PPE meant personal protective equipment. So all this is laid out outside the door in a cupboard where the physician or the nurse will need to wear the PPE before entering and seeing this suspected patient in the room. Next, I'm going to talk about the change of mode of patient care in NUH outpatients. Previously, all patients visit the hospital in the outpatient setting, they will need to come as a physical visit, that means in-person visit. Now, the mode of care from physical visit has changed to telemedicine. Telemedicine can be phone consult or video consult, and we also provide tele support. And tele support is mainly provided by allied health personnel. It can be a diabetic care nurse, it can be a dietitian, it can be a pharmacist. They will need to call patient after a phone or video consult to check on patient whether they are okay with the new drug they started on, any side effect or any low sugar. Next, we go in individually to look at the physical visit. For any patient that a clinical need is needed, that means an in-person care. For patient with first time seeing in the hospital, definitely we need a physical visit. After the first assessment, subsequently then patient can be transferred or request for a teleconsult. Patient should be able to give advice without visiting the hospital. So this first assessment is very important. And for those people that is not well, even patient with erratic blood sugar or require emergency attend for suspected cases or other cases, they will need a physical visit. For telemedicine, that means we talk about phone consult. It's normally can be a non-emergency case in nature. But then a non-emergency case in nature through phone consult sometimes can become emergency nature. It depends on patient complaint. And normally, when can we decide whether we can do a phone consult? That means patient with diabetes, they are able to do their cell blood glucose monitoring at home and able to send in their blood sugar result to us by email or by fax. And they are agreeable for phone consult. Okay, the criteria is that patient must pass the first assessment in the clinic, then they can request for it. Next telemedicine is video consult. Video consult normally is video call by Zoom. For those patients, it can be bedridden or non-ambulant or on patient and caregiver request, and sometimes can be a physician request. I got one case that patient have not been seen by my physician for more than 1 year, and we cannot continuously giving the patient the same medicine, and we need to see how is patient, so we request for a video consult. And normally they will need to access to internet through a smart device so that we can see the patient. And this family is very good family support, and they actually IT savvy. And the advantage is they save time. They no need to transport the patient that is difficult in ambulating to the hospital, and they no need to wait for the clinic or pharmacy. Everything can be delivered to home, and this will reduce their exposure to infection. Thirdly, I'm going to talk about the mode of patient education. Patient education before COVID-19 in the clinic for diabetes in pregnancy patients. Normally, for pre-existing diabetes in pregnancy, we provide an individual counseling session. Whereas for gestational diabetes, we provide group teaching, and maximum capacity for patient in group teaching is 8 to 10% with spouse. That means if they come with spouse, will be 4 pairs of partner. Secondly, for inpatient and outpatient, type 1 and type 2 patient education, before the COVID-19, we are doing the individual counseling at patient bedside or at special room if patient requests. So for dietitian counseling session for gestational diabetes can be a individual or group teaching. Individual, that means patient can be Chinese speaking that don't speak English, that require a dietitian to give personal attention in their language or dialect. Whereas for those that is comfortable, can speak English, then we'll group them in group teaching. As for type 1 and type 2 patients, then individual counseling section will be provided. Let's see what have changed. The transformation for mode of diabetes patient education is different during the COVID-19 time. For diabetes in pregnancy, individual section is still the same for pre-existing. And we have changed it to a Zoom section, no more group teaching on site. That means the maximum capacity is still 8 to 10. We will give patient the Zoom login, and patient can join the Zoom teaching at home using their laptop and Zoom out with the diabetic care nurse as well as the dietitian together for the gestational diabetes teaching. As for inpatient and outpatient type 1, type 2 patient education, it also still the same is individual counseling section, but they can request for Zoom section. For dietitian section for gestational diabetes, individual versus Zoom teaching, they are also using computer laptop, and we also make use of the Embody Diabetic app. They can key in what they eat to this app so that the dietitian can correspond with them. Every month, they will review their progress, see whether they want to continue this app or not. Then for type 1, type 2, yes, at the present moment is individual and counseling section, and all these sessions also can be by Zoom. Okay, next we are going to talk about the changes in patient education in NUH during COVID-19. The first part we can see that is before COVID-19 physical visit, what type of patient education we provide for patients. Normally, we are very detailed. We will explain everything to patient. That include understanding of diabetes, lifestyle modification, pharmacotherapy, cell blood glucose monitoring, hypo and hyperglycemia management, sick day management, and prevention of DM complications. And the time spent is usually 30 to 45 minutes. Now, in the COVID-19 pandemic, it can be a physical visit if that is a first consult, or you make use of the telemedicine. But you look at the patient education, the first thing we want to find out from patient and teach them is understanding about COVID-19. And we also need to teach them about survival skill, teach them to have enough of medication or consumable supply. And we also need them to continue doing their cell blood glucose monitoring and teach them insulin injection technique, also hypo and hyper management. The time span will need to reduce to 30 minutes, and that is the best. And during this time, we will need to streamline. Okay, we need to teach the patient what is necessary. Okay, so you'll see that we need to modify and simplify the patient education. And we teach them the survival skill. And this round, the survival skill is how to prevent of infection. And must remind and find out from them whether they go for vaccination or not. And how to manage their stress and how to relax. And you will find that the timing, we are getting shorter and shorter because all this information is very important. So we will try to keep our timing within 20 to 30 minutes. Now let's talk about in depth about patients' education on survival skill. Now, for us, we will concentrate on self-management strategies. We will teach patients how to stay up to date on COVID-19 and follow up the recommendation for prevention of infection. Next is vaccination and how to ensure they have enough of medication supply and how to maintain good glycemic control. And strongly request patients, if they are well, can self-manage themselves at home, to request to a replace of physical consult to telemedicine if they are stable. And we also will teach them how to do when they are not well. Okay, now the simple thing we teach them about COVID-19, just simple, how does this virus spread? It's through co-contact, through droplets. It can be spread by asymptomatic individual and indirectly by contaminated surface. Okay, so that they will know that how to prevent themselves for being infected. The support that we're going to give it to them is psychosocial support. Okay, psychosocial support is that during this COVID period, there's a lot of fear. Even for us healthcare personnel, we feel that fear of uncertainty, contradicting about the fast changes of information, because one day the press said can go out, one day the press said cannot go out, one day can go hospital, one day cannot. Then unknowing contracting of virus, and they can fall sick and we also might die. They also fear of adverse effect on COVID vaccination and the stress, being locked down, loneliness, boredom, insufficient supply, stigma. If I'm being isolated, my neighbor might think that I got COVID. And change of work process. During this period, a lot of people, the mode of work process also changed. Now most of the office workers, they are working from home. Doctor visit, I want to see the doctor, I cannot see their face, I must change. So there's a lot of changes. So there's a lot of things that patient is fearful of. So we must be very careful with that. One is self-management strategy. Another one will be psychosocial support. As for self-management strategy, first thing is teach patients how to stay up to date with COVID-19. Teach them how to protect themselves not becoming infected, and stay informed on the latest development in COVID-19 virus changes, and advise them to use official website and beware of fake news. Following the recommendation, patients are advised to monitor their flu-like symptoms. If they're not well, having cough, running nose, sore throat or fever, to see a doctor, do their own swab test. Practice frequent and good hand hygiene and good cough etiquette. That means cover their mouth while coughing and throw away their own tissue paper when they use to cover their mouth. And wear a mask wherever they go, or when they are not eating, when they are talking to someone, please wear a mask and avoid crowded area. Here in Singapore, we practice social distancing at least 1 meter apart, and strict self-isolation when not feeling well. Next, we need to tell them about vaccination. Okay, in Singapore, vaccination is free, and they can choose between Pfizer or Moderna. At the current moment, Sinovac also is approval, and all patients, all age group at this present moment, they can walk in or book appointment. We just opened in December, somewhere last week, that we are vaccinating for those children from 5 to 11 years old. Ensure enough of medication and support. You know, for people with diabetes, they need to do their own blood tests. They need to take their medicine regularly. So to minimize their trip to the doctor or pharmacy, when they are not well, they must request phone consult if possible instead of coming in person. And when their medication is not enough, they can ask for delivery to their house instead of queuing in pharmacy. Patients are advised always have 2 weeks to 1 month supply of extra medication and equipment like test strip. And when they are running out of medication or supply, they can contact the clinic by email or by phone in advance to get their stock sent to them. Do not pile out their medication. Next, we're going to talk to patients how to maintain their glycemic control. This is the crucial time that all people with diabetes, they are reminded that they must continue to monitor their blood sugar at least 2 days in a week and try to keep their sugar level between 4 to 10. To test the sugar level more frequent, especially when they're not feeling well, and inform the diabetic team if their sugar is out of range. And if they are working at home, please make use of this opportunity to control their diet and make healthy choices and eating more home cooked food instead of grab in, order in, okay? And change their outdoor physical activities to indoor activities and continue to do their exercise regularly. Reschedule doctor's appointment to telemedicine. Okay? Patient is advised to check and record their sugar regularly and always upload their sugar level by email to us and update us timely. To allow us to adjust the treatment through teleconsult. If the patient did not send in the profile, it's very difficult to reschedule doctor appointment or change their physical visit to telemedicine. Last but not least, patient must have a sick day plan. Day plan is very important at this period. Patient can fall sick with cold, illness, and their blood sugar will definitely difficult to control. So patients are reminded that when they're not well, they need to test their sugar at every 2 to 4 hours. And sometimes they might need to check their urine or blood ketone for type 1 if their blood sugar is above 15 millimole. Patient also advised to drink enough of water, and if they cannot drink the water at one go, they can sip water slowly, half to 1 cup of fluid on every hours. If they cannot have very good appetite, they can eat small and frequent meal. They can change their meal to 3/4 bowl of oatmeal or porridge or cup of Milo, cream soup. If they really got no appetite and they already consume their tablet or insulin and their sugar is low, they can even have half a cup of fruit juices or soft drink. Next is that sometimes patients talk, when I'm not well, my appetite is not there, I can stop my diabetic medications. Patients are reminded that whether they are well or not well, they need to take their insulin or their diabetic tablet. If they have concern, they can connect with us and give us a sugar result, then we can help them to titrate down or up their insulin dose or diabetic medication. All patients are reminded if they are not well and their sugar are above 15 millimole and their sugar reading is high and very consistent with fever 38 degree and breathless, persistent vomiting and diarrhea, and there's ketone present in their blood, then they definitely need to see a doctor. With medical attention, they definitely will get better. Next, I'm going to talk something about psychosocial support. During this pandemic period, psychosocial support is very important. Even for us healthcare personnel, we also fear of unknown. We also does not know when are we going to contract COVID-19 and what is going to happen to us. More so, patients will feel even worse than us. So keep calm, practice listening skill, provide support, and link patient to useful information and resources and service. Always be there for them. Do not pressurize patients to speak or share when they are not ready. Attend to urgent situation before providing psychosocial support. If patient give you a call and tell you that I think I exposed to COVID-19, I got all these flu-like symptoms, okay, so what you need is provide them the direction where to go. Not to tell them, no, you are okay, you are not having COVID or what. So if there's sign and symptom of exposure, tell them to do their own swab test and go and see a doctor if their swab test is positive. If they got mild symptoms, then they can stay home and isolate themselves. Always listen to them, allow patients to verbalize their need and their concern. Give them time to share. Not everybody pick up the phone, they know how to talk to us. Okay, always give them time, calm down, then listen to them. Hear them, help them to feel calm, then to problem solve. Help them to connect with the loved one and social support. Do not leave them alone. Last, my summary is self-care strategies and psychosocial support at this time is very important. And self-care management, beside eating healthily, ensure patient got good rest, good sleep. Maintain their physical activities and relaxation exercise. Maintain social interaction. They cannot be alone at home, then they will have panic attack. And I also strongly advise them, during this period, try to avoid unhealthy habits. Do not be a potato couch. Just eat at home, stay at home and not doing anything. They must continue to do their exercise, then keep connect with us. Do not be shy to seek help and support from us, and avoid alcohol or drugs. Stress coping cannot use alcohol and drugs. That will make the whole thing worse. To that, I thank you. Any question?